Now, let's take microcytic anemias first. A microcytic anemia, a low MCV. Now, you know our basic pattern. Which of the following is the most likely diagnosis? What's the best initial diagnostic test? What's the best accurate diagnostic test? What's the best initial therapy? And at all points, what would you do next in the management of this patient? What's the most appropriate action? What would you do? What is the next best step? Action, do, management. So therefore, in microcytic anemias, we cannot distinguish these based on the symptoms. The symptoms of these are going to all be the same, not based on the etiology, but based on the severity. Therefore, we cannot answer the question, which of the following is the most likely diagnosis is iron deficiency, and which of the following is the most likely diagnosis, the anemia chronic disease, which of the following is the most likely diagnosis, the sideroblastic, just from the symptoms. Which of the following is the most likely diagnosis, thalassemia. We can't answer the question, which of the following is the most likely diagnosis, just off of the physical findings or the complaints, because the symptoms are the same, not based on the etiology, but on the severity of how bad the hematocrit has fallen. Iron deficiency anemia. How can we answer the diagnosis? Which of the following is the most likely diagnosis? Well, there should be a history of increased loss of blood, increased blood loss, because iron is not that necessary, because we only need 1 milligram a day when you're not menstruating or not pregnant. So men only need about 1 milligram. 1 milligram. Remember, 1/1000th of a gram, and you need 28 grams to the ounce. That means 28,000 of these. 28,000 for 1 ounce. 1 milligram, 1,000 of them to the gram, 28 grams to the ounce, 28,000. That means 1 ounce of actual iron would be enough to last you for your entire life, because the body recycles the iron. That's why we have haptoglobin. Red cells break down. That's why we have a spleen. Recycling that iron down to a general blood loss is you only need about 1 milligram a day. Now, that goes up to 2 or 3 milligrams if you're female, because you're losing blood with menstruation, and it goes up